In a March 4th notice of proposed rulemaking, the Department of Health and Human Services offered a tentative proposal to potentially compel providers, that is, hospitals, physicians, other healthcare providers, to publicly disclose the secretly negotiated rates that they have with insurers.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals. We're honored to have Dr. John McCracken on the Business of Healthcare podcast. John is a clinical professor of healthcare management at the University of Texas at Dallas Jindal School of Management and also adjunct professor of family and community medicine at UT Southwestern Medical Center. He's the founding director of the Alliance for Physician Leadership, an educational partnership with the Jindal School of Management and UT Southwestern. Welcome to the podcast, John.
Thank you, Bob.
So, John, you started the Alliance for Physician Leadership over 20 years ago and have been providing advanced graduate degrees exclusively for physician leaders around the nation. I know that hundreds have graduated from your program and you've developed a pretty impressive network of physician leaders. You're the go-to person here at UT Dallas when it comes to addressing the myriad of healthcare topics, and healthcare is always in the news and will be a centerpiece for the national elections. One thing that's always confusing to those who consume healthcare is pricing. There's a lot of variation. John, let's talk about healthcare price transparency. Why is it so difficult to know what to pay before you get the bill?
Well, it's because the contracts between payers and providers have confidentiality clauses that prevent either party from disclosing what the price actually paid for the service is. Actually, I find it pretty incredible that the service pricing of an industry that represents 18% of the entire U.S. economy is shrouded in a veil of secrecy, and it truly is.
Well, there must be some reasons for that. I guess if you follow the dollars, you're going to find that certain people have certain interests. And with that thought, there's a lot of protection going on. So what's the history on this process?
It's difficult to say. It's really always been this way. Back in the 1960s and 70s, payers, including the government, paid reasonable and customary charges. In the 1980s, hospital inpatient pricing moved to diagnostic-related groups, and then in the 1980s and 90s, ambulatory payment codes came in to compensate providers for outpatient services. Physicians were paid based upon percentage over Medicare. Once those negotiated contracts began to be prevalent between payers and providers, the confidentiality clauses were added. It was in the payers' and providers' interest to keep those prices confidential. It's just a form of price discrimination, an effort by the provider community to extract the maximum revenue for a given volume of services.
So does this continue on and on forever, or is there any action underway today that might have some type of impact to make changes and give us some of this pricing transparency?
Well, providers would certainly like it to continue because this is once again help them maximize the amount of revenue that can be extracted from a given volume of healthcare services. However, in a March 4th notice of proposed rulemaking, the Department of Health and Human Services offered a tentative proposal to potentially compel providers, that is, hospitals, physicians, other healthcare providers, to publicly disclose the secretly negotiated rates that they have with insurers. Now, this is not a rule. It is a notice of proposed rulemaking. So HHS has really kind of laid it out on the table that they believe that they have the authority to actually compel providers to publicly disclose their actual prices that they've negotiated with payers.
So, John, you're in the industry, and so you have all these people that you connect with and a strong network. Is this new proposal something that is widely known? Is it on the headlines of the news anywhere, or is it Is something excitingly new, or is it just regular, oh, yeah, we're proposing something again?
Well, it's actually little known. It was buried on page 90 of a 187-page notice of proposed rulemaking on information blocking. So it was, if you've ever read the Federal Register, it's pretty hard to get very deep into it before you go to sleep. It caught the healthcare community by surprise. The American Hospital Association immediately responded that this would undermine choice in the private market, in the commercial market, which is a laughable assertion. But I'm sure that the industry, particularly the hospital industry and the American Medical Association, are gearing up right now, studying the proposal and its implications. And I'm sure they're going to marshal all the financial and political resources they have to prevent it.
So if this rule actually turned into a course of action, what would that mean to the consumer, the person who's out there consuming healthcare on a regular basis? How would that change their view on the healthcare industry?
Well, it would have an effect not only on patients or consumers, but on employers as well. They would actually be able to compare prices between providers, and they would be able to, well, first off, it matters to the patients because given the co-payments and deductibles, patients pay an increasing share of the cost of inpatient and outpatient hospital services. So it's important to patients to understand this, particularly, as I said, when they have so much skin in the game as they do today. But it matters a lot to employers because employers then would be able to see among providers in any given market who were the most cost-effective, and they would be able to establish reference pricing around those costs, and also to put a lot of pressure on those providers, those hospitals that had excessive charges. The charges for any given medical procedure, inpatient procedure, can vary as much as 100%, even within a single market. So being able to post and know publicly what the prices are, as I said, would put a lot of pressure on the very high prices charged by certain providers.
So, John, if this proposed ruling actually got some legs underneath it, is the government actually in a position where they could enforce this and make this happen?
Well, Health and Human Services maintains that it has the authority under the 21st Century Cures Act to compel price disclosure. Now, the issue is whether or not the pricing between insurers and providers is actually sheltered by constitutional provisions, more specifically the takings and the due process clauses of the U.S. Constitution. That's a very strong legal constraint to government interference with private contracts. But that only applies to presently existing contracts, not to future contracts. So because provider-payer contracts are negotiated annually, you could propose a rule like this that would apply when the contract is renewed, and there would be no constitutional prohibition against it. The issue is really whether or not you can do this by regulation or whether it's going to take legislation to do it. That's not clear, although HHS says that it really has the authority under the 21st Century Cures Act to do this. That act was passed in 2016 with very strong bipartisan support. And I think it would be difficult for congressmen on either side of the aisle to publicly resist legislation which, again, supported this kind of move. But we'll see. You can be certain that the industry is going to lobby very, very hard against it.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
I see recently where there's news regarding pharmacy and kickbacks and different techniques to not give rewards to the middleman, et cetera. Mm-hmm. I see that in the news. I also see free market activity out there where you can find transparency on pricing on services. Most people aren't educated to go to these websites to find out how they can shop for an MRI or how they can shop for a colonoscopy. I think there's a big education play there. But when we stop and look at the Medicare marketplace, does transparency have an effect there? Is it more transparent there than in the commercial space?
Yes, it is, simply because Medicare prices are fixed and posted. Anybody can take a look and see what the Medicare pricing is. That's not the issue. Really, the issue here that we're dealing with now is the commercial market. You know, there are 158 million people insured by employer plans in this country, and another 20 million or so that are privately insured. So those are the ones that would be affected by this.
So that really kind of brings up an interesting concept, because in the news, again, I keep saying in the news because healthcare is always in the news, you hear about a concept called Medicare for All. And Medicare for All would basically bring that type of structure, transparency, and information to everybody. You wouldn't have insurers anymore. And if you start to see where the consumer alignment might take place, if things look simple and easy, all the transparency issues are there. If people are in favor of a Medicare for All type program, you'd be pushing for transparency. And if you didn't have the Medicare for All, you need to push for transparency on the other side of the aisle.
Well, think about it a second. Medicare for All pushes the government very deeply into health care. It's one way or another, it will increase the cost to the federal government to the extent that it provides greater and greater subsidies or even subsidizes health care entirely, depending upon what flavor of Medicare for All you're talking about. It also puts government in the role of essentially allocating services, rationing services. This proposal, the HHS proposal, doesn't interject the government into healthcare at all, other than to mandate price transparency. It won't increase costs to the government. It doesn't put the government in the role of rationing care. It just simply requires that providers post their prices and let consumers do it. So to that extent, would be a lot easier to pass, and I think would garner a lot more favor than Medicare for All. Medicare for All is a pretty controversial concept.
Yes.
But I think this concept of simply requiring posted prices would move the healthcare market a long way toward a true market-driven industry. And once again, without interjecting the government any further into it.
There's a trend now moving from payment methods from pay fee for service into a value-based pricing model. Does that help the transparency call at all?
Not really, simply because notwithstanding that payers and providers are negotiating value-based payments, the contract terms are still opaque.
Okay.
They're still covered by confidentiality agreements.
Well, we always like to ask you this question: what do you think the future of healthcare is? And in the past, you've had a really great answer. I've shared it on a lot of other podcasts, John, and you always say, well, the long answer is, I don't know.
Well, the short answer is, if you're going to forecast often.
Yes.
I think healthcare is very much in play. It's going to be in play in the 2020 election. It certainly is going to be in play in the 2024 election. This is not something that's going to be resolved quickly. But I do think that this proposal, first laid out on March 4th of this year by HHS, could, if it gains legs, if it gets traction, could really have a dramatic effect on the healthcare market. Now, it will lead to considerable conflict. That is, conflict between the industry on the one hand and the proponents, perhaps government and consumers on the other. But once again, as I said, one of the reasons why I think the government might look favorably on this, and by the government I mean both political parties, is that it does not interject the government into the payment mechanism or rationing care, nor would it preclude Medicare for all. You could have both of these things, but this helps move the market closer to a market-driven industry.
Yeah, so as we look into the future, obviously a lot of changes are continuing to take place. You've used the metaphor before that if you broke down this $4 trillion healthcare industry into its parts and components, you would find that there's a tremendous amount of quality in terms of those individual parts and components. But the cost of integrating these services and parts and components into something that is, understood, that is valued, that people can actually shop for and understand what they're getting, that's the biggest assignment. So somewhere down the road, efficiency has to kick in, and that's got to affect the overall pricing component.
Well, I think what you're referring to is really care coordination. Chronic disease consumes somewhere between 70 and 80% of all the healthcare spending. And people with 2 or more chronic comorbidities that have to coordinate their own care may receive very good individual services, but by virtue of the fact that they have to coordinate those services into a total care package makes it suboptimal. Now, once again, the proposal for price transparency really doesn't help that. The answer to that is to move from this fee-for-service model where providers, physicians, are organized around their practice specialty or around a hospital facility into a model of team-based care where providers with different specialties organize around patient or disease state and provide care coordination to their patient population. That is a harder thing to achieve. That is a fundamental change in the medical delivery model, and we are still a long way from that.
So where does this go next? If this proposal is out for review right now, what would be the next sequence of events that could possibly take place with it?
Well, the government has requested comments on this, and on May 3rd, I think they're going to issue their final rule as regards the interoperability and patient access to their medical records. That was the notice of proposed rulemaking in which this sub-proposal was buried. Let's see how HHS first responds to all the hundreds of comments that are being received, and let's see what they say next. So I think sometime in May we're going to get some kind of idea from them as to what direction this might take. I haven't seen any political commentary on this to speak of. I think maybe the politicians are just waiting to see how this thing develops.
Well, that's called standby. We'll be having you back in here for another podcast in the near future. So I want to thank Dr. John McCracken for joining us for the Business of Healthcare podcast today. Thank you, John.
Thank you, Bob.
Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jindal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.